Okay, let's just dive right in. I want you to picture something. The year is 1345. You're in Paris. It's a city of mud and stone and these incredible towering cathedrals. Now, when you think about medicine from that time, what's the first thing that pops into your head? I'm guessing it's something, well, pretty brutal and primitive, right?
Yeah, we all have this image of the medieval doctor. He's basically a torturer with a bag of leeches, isn't he? A total quack who relied on superstition and prayer while his patients just suffered. But what if I told you that that image is almost entirely wrong? See, medieval medicine wasn't some circus of ignorance. It was a highly sophisticated, deeply logical, and meticulously documented scientific system. The only catch? Well, it just happened to be based on an entirely incorrect map of the human body. So, to really understand this system, let's see it through the eyes of a couple of people on the ground. We've got a young medical apprentice, we'll call him Elias, and his master, Gervais. They're going to be our guides as we explore how doctors actually practice medicine in the Middle Ages.
Our journey begins in the bedroom of a very wealthy merchant, Lord Godric, and he is burning up with a fever. Now, what does our physician, Master Gervais, do? He doesn't even touch the patient. Nope. Instead, he reaches for the #1 diagnostic tool of the time, a flask of the merchant's morning urine. So what on earth is he looking for in there? To get that, we have to talk about the undisputed bedrock of all Western medicine for, get this, over 1,000 years. Humorism. It was pioneered by the ancient Greeks, and the theory held that your entire state of health depended on the balance of 4 essential fluids in your body.
And what's really remarkable is just how comprehensive this system was. You had the 4 humors, blood, yellow bile, black bile, and phlegm, and each one had its own qualities, hot, cold, wet, or dry. But here's the kicker. They didn't just govern your physical health. They were believed to determine your entire personality, your temperament. Sound familiar?
The core idea was actually pretty simple. Health, that's a state of perfect harmony between these 4 fluids. But every single illness, from a fever to a cough, was seen as an imbalance. Too much of one humor or too little of another. The doctor's entire job was to identify that imbalance and restore the equilibrium. And this is where you can see the logic really click into place. After analyzing the urine, Gervais diagnoses Lord Godric with an excess of the sanguine humor, that's blood, which is considered hot and wet. So the treatment is perfectly logical within the system. First, remove the excess fluid through bloodletting. Second, counteract the hot and wet illness with cold and dry foods like fish and barley. It's a system of opposites. Okay, let's move to our next patient and see how this all connects. We're with a peasant woman now who has a nasty, infected gash on her arm. And this takes us from the world of theory to the medieval pharmacy, the apothecary shop, which was a treasure trove of the totally bizarre and the secretly brilliant. The apothecary's cabinet was a wild mix. On one shelf, you had remedies that seem completely absurd to us today. Powdered mummy for stomach aches or crushed emeralds for dysentery. But on the other shelf, you had things that, through centuries of trial and error, were accidentally astonishingly effective. And here is the hidden genius. That poultice of moldy bread, it often contained penicillium fungi, the source of our modern antibiotics. The raw honey they used to pack the wound, it's a natural antibacterial agent. And the tea made from willow bark to treat the woman's pain, it contains salicylic acid, the active ingredient in aspirin. They didn't know the chemistry, but they knew what worked. All right, now for the procedure that has come to define the horrors of medieval medicine. Our next case is a monk at a local monastery who is suffering from what they called the falling sickness, epilepsy, and it's accompanied by blinding headaches. When all else fails, the doctors consider the most extreme surgery imaginable. You see, within their worldview, a condition like epilepsy could be caused by bad humors or noxious vapors or even an evil spirit trapped inside the head. So the question for the surgeon was simple, if terrifying. If something is trapped inside the skull, how do you let it out? You make an exit. Now that image of a patient screaming while they're wide awake, that's largely a myth. They were often anesthetized with a potent cocktail called duale. The procedure itself, known as trepanation, was methodical. The surgeon would make an incision, use a handed drill called a trephine to grind away a circle of bone, and then carefully remove the plug, all without piercing the brain itself. And here's the most surprising part. As barbaric as it sounds, archaeological evidence shows that many patients actually survived. Skulls have been found with smooth bone regrowth around the hole, meaning the person lived for years after. And in cases of head trauma, this procedure could even save lives by relieving pressure on the brain.
For all its internal logic, the humeral system was a ship sailing on a calm sea of known illnesses. But in 1347, a storm arrived that would smash that ship to pieces and shatter the entire medieval medical world.
The bubonic plague, the Black Death, arrived in Europe and spread with terrifying speed. Nothing in the ancient texts of Galen or Hippocrates could explain a disease that killed the young and healthy in a matter of days, regardless of their humoral balance.
The scale of this catastrophe is almost impossible for us to comprehend. This chart shows it starkly. In just a few short years, the plague wiped out as much as half of the entire population of Europe. It was an apocalypse.
So, faced with total failure, the medical community abandoned humors and pivoted to a new theory, miasma, or bad air. And the cures they prescribed were acts of pure desperation. They tried everything from ringing bells and firing cannons to break up the air, to carrying flowers, to even sitting in sewers, hoping one bad smell would fight off another. Nothing worked. So how should we remember the medieval doctor? Not as a fool or a butcher, but as a pioneer, a brilliant navigator working with the best information they had.
This really captures the heart of it. They had built this massive, logically consistent system to make sense of suffering. The problem wasn't their logic, the problem was their map. Their fundamental understanding of the human body was just plain wrong.
And this is the ultimate legacy of that terrible plague. The sheer number of dead loosened the strict religious bans on human dissection. Doctors realized they could no longer rely on ancient texts. They had to look inside the body for themselves to draw a new, more accurate map. The Black Death destroyed the old system, but it laid the foundation for the anatomical discoveries of the Renaissance. It leaves us with a fascinating question to ponder. These were brilliant people, operating with the best knowledge of their time, but their core assumptions were flawed. It makes you wonder, a few centuries from now, which of our own firmly held scientific beliefs will look like an incorrect map?
Please like and subscribe.